Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast.
Hello, everybody. Up, the door worked, so I guess that I can do another podcast. They still haven't locked the door yet, so I guess maybe one person likes what we're talking about. So they haven't locked the door on me yet, so I'm thankful for that. Thank you for joining me in another podcast, Destroying Diabetes, where we try to get information to you to help you control and possibly reduce your symptoms and possibly reverse type 2 diabetes. Our concentration is on type 2 diabetes. I'm a type 2 diabetic myself. And so I'm speaking from my own experience as well as being a type 2 diabetic and being a healthcare professional. So thank you again for joining us. And I appreciate all the kind words that people have given me so far about the podcast. And I just want to continue to provide information for you. And then also we have contact information if you like to talk to me or work with me further. We have a new program where I can provide counseling and coaching for you or a loved one that has type 2 diabetes, if they're interested in reducing the effects or even reversing type 2 diabetes, I can work with you. You ask, why would you work with me? I got a doctor. Well, you do have a doctor, and then as you know, that it's hard to see them in most practices that they have. Tons of patients and don't really have the time to really sit down and work with you. And with working with me, I have the benefit of being a diabetic, type 2 diabetic myself, and also being a pharmacist. So I can help guide you as we reduce and get your blood glucose under control, help guide you on the path of reducing medications, work alongside with your doctor, make recommendations to him or her, and we can help either reduce or eliminate your medications over a period of time. So please do get in contact with us. We have our contact information on YouTube. You can also email herseyhealthhelp@gmail.com, and that's the quickest way to get in touch with me. Reason today doing the podcast, this the day before my birthday. Probably when this episode comes out, it'll be post my birthday, which is the 26th. So in celebration of my birthday, just decided to do a podcast just to give some more information. What I'm going to do briefly is just kind of break down, simplify what exactly type 2 diabetes is. A lot of times you'll get a lot of jargon, a lot of scientific terms that you may not understand, and you're like, Doc, what is type 2 diabetes? I know what you say. My sugar is high. That's about all I know. What does that mean? How does that happen? Well, stick around. I'm going to briefly go over it in just a more direct and maybe hopefully a more simple way to understand. And like I said, you can email me if you have questions, or you can contact Hersey Pharmacy as well. You can go to our website, herseypharmacyrx.com. You can go there if you need to, schedule a consult and want to work with us further, or get involved with my coaching program. We can do that. So simply, type 2 diabetes we talked a little bit about it, addressing with the myths. Basically, what it is that just think of your body centered on insulin. Insulin is produced by your pancreas, and insulin has a role in everyone's body. What insulin's job is kind of to do is to move when you eat. Food is broken down in lots of different materials, and one of the materials that is broken down into is glucose. And glucose is what your cells need as far as provide energy, so your cells can function at the high capacity, whatever that they're doing. So what insulin's job is it's produced from the pancreas, secreted from the pancreas, gets into your bloodstream, and it sees the glucose that's broken down from when you've eaten. And what it does is take that glucose and say, oh, this glucose doesn't belong out here in the bloodstream. It should be in the cells so the cells can have energy and do their job. So what it does, it helps move that glucose from your bloodstream into your cells throughout your body to help provide energy so that you can perform all sorts of wonderful functions from seeing, movement, everything that you can think of, heart, just from your heart beating, lungs. So affects every part of your body. So every part of your body that you have cells needs glucose to function. So insulin does that. It in a normal person, it takes the glucose out of your bloodstream, fashions around to different parts of your body where the cells can use that for energy, and that's well and good, and that's normal. What happens with type 2 diabetes is that usually when it comes to a certain point is that your body is producing you have a lot of glucose into your bloodstream. And what happens over a period of time, first your body, pancreas adjusts. It's like, oh, well, I'll just make some more insulin and just get rid of this extra glucose that's lying around here. And so for a while that works. Your body is able to secrete enough insulin to continue moving that glucose out of the bloodstream and into your cells. But eventually what happens is that it gets to a point where your body's just pumping insulin. After a certain point, your body is not able to remove all that glucose out of your bloodstream and into your cells. And then also what happens is that at the same time, your cells, because they've gotten used to this high level of insulin, that the cells become insulin resistant. So you're not able to produce enough insulin to override this resistance and to be able to put that glucose into the cell where it's supposed to be at. So eventually what happens is that the glucose level in your blood builds up over time, and eventually it gets to a point where it starts affecting your body, because one of the big things in your body that people experience, and one of the big complications that people experience with type 2 diabetes, or when people start becoming aware that they're diabetic or even pre-diabetic, is that you may experience like a lot more thirst. The reason you experience a lot more thirst is because you're dehydrated. Yeah, so you're dehydrated because your body is not getting the energy, and then with the glucose in your bloodstream, that's blocking the flow of blood and liquids in your bloodstream. So you end up being dehydrated. So that in order to meet that, then you get a lot of thirst. So you try to replace it with fluids because your body's like, hey, we're like dehydrated here. We don't have enough liquid to move the blood and move everything like we need to. So your body signals your brain to be like, drink more fluid. And unfortunately, most time when people are diabetic, even though they don't usually are not usually drinking water, they usually are drinking, unfortunately, juice, soda, things that are not really healthy for you. So that just complicates, and these drinks are loaded with sugar. And so guess what? So they add to the glucose that you already have in excess, and therefore makes a lot of times makes your condition worse. So usually that's one of the things. And also because your body, your blood is full, has a high level of glucose in it. So your body is like, it's not supposed to have this high level of glucose in here. So your body starts trying to get rid of it. And the biggest way that they get rid of it is through urination. And so it's trying to cause you to urinate this excess glucose out of your body. And of course, this adds to the dehydration as well, because that's helping lose fluid as well in your bloodstream as well. So that adds to the dehydration. So you got all this. Usually that's the biggest signs. You usually like thirsty a lot and you're urinating a lot. That's usually the biggest signs that people see when they're becoming diabetic with type 2 diabetes. Also, another thing that happens is because the glucose is sitting in your blood instead of in your cells providing energy, most people feel lethargic, or they feel less energy, which is true because your cells are not getting the same amount of energy that they used to get. So your whole body starts to feel drained, starts to feel down. So that's a lot of times, that's probably the other biggest sign of diabetes, is usually that you fatigue easily, that you're more tired, you're more listless. It's hard to get the energy to do things. So usually people experience these things, and then usually if you go to the doctor, then the first thing they'll do is that they'll let's have a test. And the test is usually like the hemoglobin A1C test, the glycosylated hemoglobin test. And what it tests is that when you have glucose in your bloodstream, it usually attaches to a part of your red blood cell. And that glucose that attached to part of your red blood cell is what the hemoglobin. And so that the test, what it does is measures the level of glucose that's attached to the hemoglobin. And usually that's a good sign as far as how much over like a longer period of time. It's not just a snapshot. It's over usually get a good indication of how much the level of glucose for like 90 days. So that's why a lot of times the doctor doesn't have you do the A1C test by every 90 days, because that will give you a better reading, a better idea of your doctor of how your glucose level is being. If it's done sooner than that, it might not be indicated. It might not catch, like if your A1C, if your blood glucose levels has gone down or gone up over the last 90 days. So you usually that's one of the diagnoses now, is that you have that test. The result is usually 6.5. Usually if it's higher than that, usually you're diagnosed with diabetes. But even if you're over 5 now, they start looking at you as pre-diabetes, because they're like, remember, this builds up over time. It doesn't happen in a day or a month or maybe even 6 months or a year. Just gradually over time, the blood glucose builds up in your bloodstream, because as your cells become more resistant to insulin, more glucose builds up into your bloodstream. So that so at first it might be like your body may be able to generate enough insulin to push that glucose into your cells, but eventually your cells become resistant to the insulin, and it's not able to push all that glucose out of your bloodstream. So that's usually like the first signs, like gradually like your blood glucose level goes up in your bloodstream. And usually, like I said, if it's usually above a 5, then that's usually what people may term you pre-diabetes if you're between a 5 and a 6.5. And then that's like kind of warning, like you're headed this way. So you need to make, usually in that stage is usually lifestyle changes. If you improve your diet and improve like physical activity, that may, you may trend back down because you're not at the point where it's diagnosed as type 2 diabetic yet, but you're headed to that path, and you can reverse that by making lifestyle changes first. And sometimes they may prescribe a medicine called metformin that usually, if it's used early, that helps reduce the A1C as well. And then if you get your A1C under control, they may reduce or take you off of that. But so usually now that's usually like the telltale sign is that A1C reading, because that gives the doctor a good idea about how your blood glucose has been running the last 90 days. So once you like that, and then definitely if you're over 6.5 A1C, and also they may have you start measuring like your blood glucose with a blood glucose device. Usually it's preferred to get like your fasting. So after you wake up in the morning and you've gone at least 6 or 7 hours. So that usually is a kind of like your baseline, your bottom line. So usually that's what's usually recommended initially, because that's going to give the best indication of what your blood glucose, what the bottom line is. And so if you get readings and if they're constantly like over 126, like with fasting, then you will probably be diagnosed as having type 2 diabetes. Now, if it's between 90 or 100 and 126, again, then people will say that's like indicative of pre-diabetes, that your is elevated. It's not abnormal, but it's elevated enough that is like you're marching on the path to type 2 diabetes. So you're pre-diabetic, and you need to make lifestyle changes to stop the fall into diabetes. So it's very important that you get your regular checkup, so that if you're headed to that path, they can catch you in the pre-diabetic stage, because it's a lot easier to reverse at that stage, because then it's mostly lifestyle changes. You may not have to take any medication, or if you do, it may just be metformin until your blood glucose is under control. Once you get type 2 diabetes, because unfortunately a lot of people don't get it checked, or usually maybe an event may happen before they're diagnosed, like they may have an episode of extremely high blood sugar, and they may pass out. Like I told you the story of my father, that he had temporarily lost his sight while driving because his blood glucose was so high. Or people have some kind of issue with their organ. Unfortunately, people may have, a heart attack or stroke or something like that may have been brought on by the high level of glucose in their bloodstream. I've worked in the past when I was doing clinic rotations when I was in pharmacy school. I remember there was a patient that came in the ER and was working in pharmacy. I think their blood glucose, because usually like anything above 200 is considered really high. This guy came in, he probably was about 350 pounds. He was, I think that's the highest I ever heard. I heard they've had is like 480. Needless, he had cardiac event, and that's why he was in the emergency room. But I just couldn't imagine someone's that high and had never been diagnosed until that happened in the emergency room. So that's the importance of just making sure that you're getting regular checkups, just keeping on top of everything, and make sure that your provider is keeping on top of everything, because it's so important, especially if you have a family history of diabetes, or if you're overweight, or maybe like obese. You really got to watch that, because that affects everything else. Like I said, the glucose in your bloodstream is not good. It can affect your other organs. That's why people, if diabetes is not treated, that's why people are subject more to heart attacks or strokes. People are more susceptible to, because this glucose gets all in your bloodstream and it affects blood vessels, and it can help destroy blood vessels. So that's why people suffer blindness, because the blood vessels in their eye are usually damaged by the high blood glucose, and then eventually some of these blood vessels break, and people have problems with their glaucoma, and they have problems with their retinas, and the leading cause of blindness is through diabetes. So if we can get diabetes under control, we can eliminate a lot of blindness that goes around in this country. Also, another part that's heavily affected by high glucose is your kidney, because your kidney is kind of like your filter of the bloodstream. So if your blood is full of glucose, that can affect all the vessels and tubulars in your kidneys, and cause your kidneys to be damaged and not function right, and can lead into kidney failure. And it's a big cause of kidney failure too. So I just want you to really take care of yourself. I hope that this information just provided just some brief, simplified information so you can understand what type 2 diabetes is, because a lot of times people don't necessarily really explain it or break it down to you what exactly type 2 diabetes is. And I just want to stress the importance of just making sure that you have regular visits with your doctor. If they see anything trending or whatever, to take care of it. Don't ignore it. If someone says that you're pre-diabetic and you're headed that way, please really look at the recommendations and just make the lifestyle changes. And if you do need medication, you use that. But mainly concentrate on lifestyle changes that you need to do to push yourself back into being non-diabetic. If you're diabetic, make sure that you're keeping on top of everything, because the dangers of high glucose, the damage it can do to your organs in your body, and just like having low energy, just bad health in general, and inflammation through the roof is dangerous. So, like I said, if you want to, work with me, I can help you with that. We can get you from being type 2 diabetic to being just having normal blood sugar levels. I love taking on the challenge of working with you. So please feel free to contact me, and I hope that you continue good health. If you have any questions, please email me, or you can contact me through the website or phone number 919-346-4008. Thank you so much for paying attention to another episode of mine. So hopefully if they don't lock me out and I make it through my birthday, I'll see you on the other side. Thank you, and be blessed.